Today we are joined by Ms. Ulrike Beilenhoff, a leading expert in endoscopy hygiene and ESGENA member, where she focuses on the critical importance of infection prevention in endoscopy. How do practical design features support staff in implementing hygiene measures more easily?
In a daily routine, endoscopy and reprocessing staff works under a high workload with a lot of time pressure, and therefore standardization is a key issue to maintain a high quality of reprocessing. So it helps me really to keep all the steps. On the other hand, when the machine is doing it, I'm released from workload and I can use the time for doing other things.
A design feature like a disposable cap, like the DEX system we have from Pentax, also is probably a key feature that might prevent infection in endoscopy, right?
That is what also studies showed, that we have a very critical part of the duodenoscope with a lot of small areas where dirt can be left, where small damages can occur. And if I have a disposable cap, I can take off the cap during the reprocessing cycle, and with these disposable cap, I replace not only the cap, but also the elevator mechanism. And that is really a great help that I have a clean device for every patient.
What are the most effective strategies that you would actually recommend to endoscopy teams to maintain high hygiene standards in their daily practice?
I think the key issues is awareness and education. So I need a lot of specialized knowledge and skills. And in addition to that, I have to raise awareness so that the staff understand what key role they have in preventing endoscopy-associated infections. I can reprocess an endoscope in a washer disinfector. That is a great step of automation. But in addition to that, I have to prepare the endoscope to be inserted into the machine. Therefore, I have to pre-clean the endoscope at the tower, and then I also have to do a lot of manual steps before I put the endoscope into the washer disinfector. I have to clean it. So if I have a system like the Aqua Typhoon, which allows to clean the outer surfaces and critical parts of the endoscope, but also to clean the inner surfaces, so the complex channels, then the machine is doing that for me. And also it also does the leak test, but the machine is doing the step-by-step for me. So it is ensured that all the steps are done and I'm released from the workload.
Talking about workflows in the hospital, also like having the endoscopes ready for the next procedure, having them dried and also stored in an appropriate way. I mean, we can talk about, for example, the Plasma Typhoon, who's actually taking care of the drying of the endoscope. Is there something you want to mention about this? Is this actually really improving the daily work of the endoscopy teams?
Yeah, a lot of washer disinfectors only have a very short drying cycle or no drying cycle. So I need to dry an endoscope before I store it, and I have to get rid of the fluid when I directly have to use it at the next patient. So therefore, a standardized system like the Plasma Typhoon helps me to dry my endoscope properly in a very short time, within 1 or 2 minutes, and then I can decide, do I want to use it on the next patient or do I want to store it? And this is really a key issue for me.
Okay, thank you so much. We really appreciate you joining us today.
Thank you very much.